Assemblymember Bloom has been a champion for issues that AHA cares about and a champion for issues that the public health community cares about in the legislature. But even before that, on the City Council in Santa Monica, as Mayor of Santa Monica, Assemblymember Bloom has been a champion of these issues. And so I am thrilled to be able to introduce you today, Assemblymember Bloom, and would ask you this question, and that is, what role does evidence play in the policymaking process, and what role does and how? So that's the first question. Then the second question, I think, is how do we more effectively deliver research results in a way that can have an impact in the policymaking process? I think, we've got a room full of some just really great nutrition scientists and researchers, and one of the challenges that I think they've found is making that connection with policymakers in a way that policymakers will grab onto the data and do something with it.
From my perspective, evidence is everything. And how we consume that here, I think it's, how I consume it is by learning about studies, reading them, and then trying to integrate the information that I learned from studies and the kind of work that you all do into policy making. Now, I can't tell you that every legislator is doing it the same way. I think what's important is that somehow the academic research make its way into newspaper articles, magazine articles, and so that it's in a form that's more commonly digested, not just by legislators but by the public as well. Because the only way we're going to turn the tide on this issue is by really constantly hitting people over the head. And when it comes to, for example, sugar-sweetened beverages, I think it's the volume of material that's beginning to sink in here in Sacramento. I'm not saying we're on the verge of anything dramatic. I would never say that, given the experience I've had with trying to legislate on this issue, which in a word has been very frustrating. But every time we in the office hear about a study, hear about scholarly work, see a newspaper article, something that's written in a journal, we're collecting that information and circulating it as much as possible. We're up against a very difficult foe, one that is financially entrenched in the state, one that claims that if we're to ask consumers of sugar-sweetened beverages to pay a little bit that goes into a fund, that's going to be the end of their industry, and people's livelihoods are going to be lost. And there's a lot of money behind that argument, frankly, and there's a lot of infrastructure in the state that influences legislators. So you put all that together, and our fight, as you know, is a very complex and difficult one. So the information, the evidence, to me, is key. We're not just making an argument that we somehow made up because it sounds good to us, which, frankly, there are a few pieces of legislation that fit that model. This is something that I think is really demanded by the evidence, and I think if we keep hitting people over the head with it, that's just what we're going to have to do. In a sense, and I'll close with this, it's a little bit like the climate change fight, in that there is an entrenched industry. There are people who profit by a contrary point of view, and as you know from that debate, it's been very difficult to overcome, even in the face of extraordinary and overwhelming evidence.
Thank you. Do we have questions from the room? Yeah, Maris Ash.
Hi, I'm Maris Ash, and I work with a nonprofit here, based here in California, Change Lab Solutions, and I live in Berkeley. And I was saying earlier that in the Berkeley soda tax effort, the Berkeley Federation of Teachers became an ally. And I know in places, the first time that Philadelphia tried to pass a soda tax, it was the Teamsters. I'm thinking of the well-entrenched foes. The Teamsters that really took down that initial effort. The city came back successfully later. But I do think the Berkeley Federation of Teachers were an important ally because we had organized labor as well as the faith community on our side. And so we were able to balance some of that political pressure. And I wonder if there could be something more specific in this legislation to help build a constituency, whether nutrition education in schools or something like that, that a constituency could come together around to give some political clout.
Yes, and in fact, I think that's where we get a lot of our support, and we need to continue to build the coalition around this issue. It really started with organizations like the American Diabetes Association, the Heart Association, and a lot of individuals out there. Teachers are important, nonprofits are important, the Community Health Clinic Network in the state has come on board and has been very instrumental in spreading the word and working the bill when we've been doing that. Where we really want to place a lot of emphasis is on the minority caucuses and on the minority and disadvantaged communities in the state that are disproportionately affected by the crisis of obesity and type 2 diabetes and the associated other diseases that we know can be traced back to overconsumption of sugar and sugar-sweetened beverages. So I actually cannot emphasize enough how important that is. You read about identity politics a lot, and this is very much an issue where we need to bring into the fold, and there are a number of reluctant members in the African American caucus and the Latino caucus. It's taken a lot of time. We do have some traction with individual members and in those communities, but we really badly need to grow that coalition and solidify our support to more and more members.
Sarah?
Assemblymember Bloom, thanks so much for joining us. My name is Sarah Bleisch. I'm professor of public health policy at the Harvard School of Public Health, and I was thrilled to hear you lead by saying that evidence is everything. And my question is, even in an area like sugary beverages where the evidence is really clear, when studies come out and that are contrary to that, do you find that it's confusing for people that you're communicating with when there are these contrary findings out there? Or do you think that people get it, that evidence is controversial even if there's an overwhelming balance in one direction?
No, I think it's counterintuitive to, I mean, I guess when you say people, it depends what group of people you're talking about. So I think with the general public, it's still, I don't know if it's counterintuitive. I think it's something people don't want to believe. We like us our sweets, and the brain tells us to love our sweets. So the brain, I think, also tells us that we shouldn't like anything that threatens to take that away from us, and that's a pretty big hill to climb. It's very steep. So I don't know if that's helpful. I think that's reality, and politicians reflect that same thought pattern. I'm not going to tell you who the members are, but I can tell you some of the members here who you would think would be the least likely to pick up a can of Coke and drink it in the building here are doing exactly that. It kind of shocks me when I see it. These are, in some cases, people who support our legislation, but they're modeling the opposite behavior.
Pat, did you want in?
Yeah. Hi, I'm Pat Crawford from the Nutrition Policy Institute at the University of California. And thank you for your work and leadership. We really appreciate it. I wanted to know if there's anything that you need from us. We're a bunch of researchers here. And, whether it be related to the science or related to the disparities or related to anything. I just want you to know that we're here, wanting to provide the information that will help you do your work.
That's a good question. I mean, I think you need to keep the work coming. Keep working on the nuances of this issue. Keep the information flowing. I think some additional studies on the communities, or studies writing about the communities that have adopted policies with respect to sugar consumption, Mexico and Berkeley, San Francisco, other places that are in the vanguard on this movement. It would be, we have seen some data from those communities, but we need to really understand that that's working. I'm looking to my right because actually I want to introduce to you, we'll bring it up. Nardos Girma is here in the office. Nardos has been working hard on this issue for 2 years now. Mm-hmm. Yeah, this is her second year on it. She's very vested in the fight along with me, and maybe she has something to add. I'm sorry, I'm putting you on the spot.
No, it's fine. I've covered it all. I think one important thing is building a pipeline of communication to your local elected officials. I think members are often attuned to listen most closely to the people within their communities, right? So whether it's a research institution or a clinic or another entity that deals with this issue firsthand, whether it's from the medical side or from the research side, I think if it's a face that they see regularly or an institution that they're familiar with, I think that often has the ability to get the information across to them much more than a perceived outsider would. And so I think in terms of building strategy, that's an important aspect of it.
Great. Well, I think we're going to close off questions now. We only had 10 minutes for Assemblymember Bloom, but thank you very much for your time. I really appreciate it. Again, on behalf of the Heart Association, thank you for your long-term leadership on health issues, and we really appreciate you joining us today.
You're very welcome. I'm not. Let me close by telling you that I'm not going to apologize for the Cal sign that I put in front of the camera.
Unfortunately, no one in the room, we didn't have you on the screen, and so no one in the room was able to see the Cal sign. So if you want to take it, you grab it again.
Great.
Bring me that thumb.
Okay, go Bears.
Go Bears. But I do want you to know that I attended UCLA for 2 years before I transferred to Cal. I have dual loyalties. Thank you all very much for your hard work.
A real policy.
Yeah, thank you very much. We really appreciate it.
You're very welcome.